Well, this week, starting yesterday, we're vaccinating people 75 years of age or older, and also a small group who we've defined this group before, but it's a relatively small group who have congenital, early onset, or inherited medical conditions, and for the next several weeks, the "and" is important, are people with developmental or intellectual disabilities. Local boards are now reaching out to those individuals. So you don't have to call. Local boards will be reaching out and have already started to reach out to those individuals. So these are the groups that we're vaccinating this week. I have some good news as far as the number of shots this week, the number of doses of vaccine that will be available to our older Ohioans. And if you recall, we've talked about this, that at least as far as we can see out, it's going to run roughly 100,000 a week that we're going to be able to designate and devote for those Ohioans who are older Ohioans. Again, this week it's 75 and older. And next week it'll be 70 and older, and the week after that 65 and older. And then we'll hold right there at 65 because we know that that is a very large group from 65 up. And it's going to take a number of weeks to be able to cover everyone in that age group that wants it. But I want to talk a little bit about how we have some extra doses this week, more than the 100,000. We have been averaging about, and it does vary some, and there's no guarantee from week to week where it's going to be, but we've been averaging about 146,000 doses, split evenly between Moderna and Pfizer that are coming in as far as first doses that are coming into Ohio every week. We won't talk about the second doses, it just confuses it, but the second doses are following up, and we've seen no problem with that. But 146,000. In past, for example, last week, we had more go to the 1A group. This is 1B. But we're starting to finish up the 1A group, and some counties have totally finished up the 1A group. So what that means is that of that 146,000, more than 100,000 this week and next week we'll be able to devote to the older Ohioans and the Ohioans who fall into that category. Now it will vary somewhere between 100 to 110, 120,000. The weeks will be different, but that's how it will vary. So you'll have an uptick from that 100,000 for that because we're simply getting more, putting more focus on, we're able to put more focus on those who are older Ohioans, who we know bear the gravest risks, the most important risk, because we're finishing up the 1A. When we get very far into it, another week though, we're going to start drawing down, and some of it's going to have to be devoted to people who teach in our schools, who work in our schools. So this is a kind of a 1 week uptick there. We have a 2 week uptick though that's also significant, and I want to talk briefly about how this really came about. At the beginning of this whole process, the federal government required us, if we wanted to be in the program, to really focus on nursing homes, and we did. And I'll talk about that a little later, why that was so very, very important. What they required us to do is really set aside effectively 353,000 vaccines that would eventually go into these congruent care settings. And they were just set aside. And as we go week to week, our pharmacy partners who are going into our nursing homes, who are going into our congruent care settings, draw that down. It's like a bank. They draw this down. But we were required to put that in that bank at the very, very beginning. Well, as we went on, it's become clear that not everybody in the nursing homes is going to take the vaccine, not every staff member. And we really knew that, of course, going in. We didn't know what those numbers were going to be or how that was going to play out. So I got to thinking last week, what the federal government had said was, when the whole pharmacy program is over, when you're done with all your congregate care settings, we'll give you back what we haven't used. And that was supposed to be at the end of March. And so I got thinking last week, we urgently need these. So I went to General Perna, got on the phone, and said, look, we know we're not drawing down these. We're not going to draw the entire number down because we're only running a 45% or so, 50% at the most of our staff that's taking these. And yet we'd set enough aside, because they required us to, for 100% of that and 100% of the residents. So I said, look, can't we draw some of these back now? Why do we have to wait until the end of March? And so they said yes. And so that's really, excellent news for us as we move forward. So we're going to have another 77,000 spread over 2 weeks. So very happy about that. 38,500 this week, 38,500 next week. And those we will be able to devote and have already devoted and will devote next week, that extra 38,500 to our older Ohioans. Just very, very important that we move as quickly in that area as we can. But I just wanted to take a minute to explain how these numbers work and how we were able to pull this number down when, frankly, we didn't think we were going to get these back until the end of March. So happy that they were flexible and happy to be able to get these back. Let me talk for a moment about our our congregate care settings and why we have set these up as such a priority. The reason is, this is, as we said, this is where we've seen the most deaths. Over 50% of the deaths in Ohio have come out of our nursing homes. And why is that? Why are congregate care settings, are people so vulnerable? Number one, you have the individuals who are there generally have a medical problem, and they certainly almost always, not always, but almost always, are over 65 years of age, and they have a medical problem. Also, they're living in a congregate care setting. They're living in close proximity to each other, and we know the nature of this virus is that it spreads very, very, very quickly. So we really put a focus on these nursing homes. We have 953 nursing homes in the state of Ohio. First dose, as I said, pretty much done. Second, we are actually second in the nation for number of people vaccinated in nursing homes. We have a lot of people in nursing homes. We've really concentrated on it. We're now in the process of going back for the second dose. And, we're happy that to be able to, have those done. Assisted living, we started on assisted living, another congregate care setting where the risk is high. We're well into those as well. But let me mention several others that I don't think we've really talked about. And we decided we want to do these early on, again, because of the grave risk that these individuals have. State-run developmental centers, our state-run developmental centers. We're very happy. 89% of the residents there have taken the shots, the first vaccine. 89%. We're very happy about that. 531 people that constitutes. Our state-run psychiatric hospitals, 73% of long-term patients have now been vaccinated. So we've gone through the entire, all of these state-run psychiatric hospitals. Our state-run veterans homes, I did mention this before, 92% at our two veterans homes in Sandusky and Georgetown, 92% of our veterans who are residents there took the vaccine. Again, another group. And a final group I'd like to talk about is people with developmental disabilities who are not in state-run facilities. They're just out in the community, living in communities. Again, we've been able to vaccinate so far, 5,500 vaccinated so far. We continue to work on these individuals as far as getting them vaccinated and reaching them. And this is the effort that's being made primarily by our local health departments. And our local health departments are really doing a very good job in this area. Butler County, for example, covered all of those individuals in their county with developmental disabilities and mental health, as well as mental health. and that they covered actually Butler County, if you can believe this, covered 250 separate locations. So hats off to Butler County. Thank you very, very much. Muskingum County has done a great job in this as well. A smaller county, but they've covered 50 separate developmental disability facilities in Muskingum County.